A facelift is an operation that's designed to correct descending tissue. As we age, our tissue loses elasticity and tends to drop. This obscures our jawline, giving us jowls, and creates excess skin in the neck. Facelifts are designed to pick this tissue up and put it back to where it used to be. Through the years, I've developed my own personal technique for facelifts called a dual plane plication lift. I've developed it for a variety of reasons. Mostly because patients were concerned and scared of facelifts. They were afraid they'd get an overpulled, exaggerated look or have a very long recovery. The dual plane plication lift avoids most of these issues. It starts with a small incision in front of the ear, extending in the back of the ear and then gently into the hairline. The skin is elevated a very short distance, and then the underlying muscle is identified. This is how facelifts really work. We take the muscle underneath the skin and pull that back to reposition the skin with it. So in essence, the skin is just coming along for the ride. If we pull on the skin, patients get a very unnatural, drawn-in tight look. This operation, again, pulls on the muscle. There are 3 individual suture lines in the dual plane plication lift. The first extends from one cheek down across the jaw to the neck, takes the entire piece of muscle, which is one sheet, starting right around the cheekbone, extending across the jaw and into the neck, and pulls it back in this direction. The same suture line is done on the other side to resuspend all of that tissue. A third suture line is then performed underneath the chin through a very small incision here. We can secure the muscles back together under the jaw. This in essence creates a very tight corset or sling underneath the skin that extends from cheek, under the jaw, and back up the other cheek. The skin is then gently relayed down on top of it, creating a very soft and natural look. For a lot of patients, facelifts sound very scary, like a big operation. In fact, the recovery is really quite quick and quite short. You go home the same day or spend the night in one of our local hotels with one of our nurses. The next day you go home in very little pain and discomfort. There is no drain. You can shower the next day. There are no dressings to wear. The first 7 to 10 days you'll probably want to stay home because you're a little bruised and swollen. Most women by 12 to 14 days look good enough they're back out in public and people cannot tell they've had surgery. They'll of course still feel a little stiff, a little tired, a little sore, but it's very hard for other people to tell. People frequently ask what's the right age to have a facelift, and it's not really a question of age, it's a question of anatomy. Facelifts again correct 2 very specific issues. Descent of the cheek tissue, which creates jowling along the jawline, and descent of the neck skin, which creates excess tissue in the neck. If you have either one of these issues, despite your age, you're a good candidate for a facelift. Most patients who come in for a facelift do not think they're the kind of people who would ever get a facelift. However, they wake up and look in the mirror one day and realize the person looking back at them is not the person they feel like on the inside. When this happens, it's frequently because the skin of the face has dropped, descended, obscuring your otherwise pretty jaw and neckline. So if you're looking older than you feel and you think you might want to change, the first step is to have a consult and determine if a facelift is the right operation for you.